Laterally. So 1, 2, 3 is internal, 4 and 5 is external. Now take a look at his leg right now. His leg is internally rotated, correct?
Yes.
Right? His leg is internally oblique. But look at his foot. Is the foot internally oblique?
No.
It is not, right? So be very careful because this will happen a lot with patients. They will turn their leg but not turn their foot. So it's very important that when you do the oblique, this side of the foot, the pinky side, is following along with the rest of the leg. Okay, so turn your foot as well, Daniel. Good. There you go, right? See, now the foot is obliquing, right? So we need to get this oblique of the foot, not just of the leg. I'm just gonna slide you forwards a tiny bit. Yep, there you go. All right. Notice that I'm also back to a straight beam. Okay, so the angled beam is only for your AP. We're going to be using a straight beam for your oblique and your lateral toes. Okay, collimation marker still the same. Sorry, I should probably make the IR look nicer. Okay, there we go. Okay, so if we were doing toes 4 and 5, right, we would just turn the foot the other way, but it's the same idea. Now, Daniel, I'm going to have you turn your whole body towards me. Good. All right. You can stay just like that. So now we're going to be doing lateral toes. Okay, so I'm going to lift your. So when you control the toes, when you control the feet, when you control the ankle, you are going to control it using the knee. Okay, the knee is going to determine how much of a rotation you have down here. Do you see that?
Mm-hmm.
Right? Okay, so the knee will not necessarily be all the way flat like this. Because when you get the knee too flat, you end up with over rotation here. So it all depends on your patient's anatomy. You're going to use this knee, move it back and forth, try and get a good lateral down here. Now, when we turn the patient lateral, we're going to be doing a lateral, once again, of say 4 and 5. Okay. Now, most clinical sites don't care about OID, so even if they're doing toes 1, 2, and 3, they'll still turn the patient laterally. Now, because we are in lab, we're going to try and do things as optimally as possible. So in this case, we would actually have Daniel turn the other way if we were worried about this first toe. So now, Daniel, sorry, I'm going to have you turn in the opposite direction. Okay. Now, as you can see, I'm going to get this foot all the way sideways. Try and turn, try and turn, try and turn. Yep. Okay. Straighten this leg out slightly. Good. And then bring this knee down as much as you can. Yeah. Turn your knee down. Turn your knee towards the right. There you go. Right. As you can see, this position is not as comfortable, right? This is very uncomfortable compared to the previous one. So it is important that you do work fast once you get the patient in this position. Fortunately, we're doing demo, so we're not going to be going all that fast. All right. Lift up just a bit. I'm going to move this cassette. Okay, good. Back down. So for this one, for the lateral toes, we are no longer centering at the MTP. Instead, we are going to center at either the IP for the first toe or the PIP for 2 through 5. Okay? Now, how do you get the toe by itself on a lateral? For the first toe, it's easier, right? It's easier for the patient to flex these toes. For something like, let's say, the second digit, right? Are you able to get the second digit by itself? Can you hold that position, Daniel? Yeah, right? That's what I thought. Okay, so in that situation, you will need something to move the toes out of the way. So you could use tape. Okay, if you don't have tape, you could use something like paper towel, gauze, something that's somewhat radiolucent, right, to help kind of pop that toe out of the way of the other ones, right? Something like this, okay? But either way, your goal is to try and get whichever toe you're interested in, right? If it's the third one, right, you could put it like this. If it's the first one, if you're not confident they can still hold these, you can put it like this. Right? But the whole idea is just to get this toe out of the way so that you can clearly center on either that IP or that PIP joint. And our goal is to try and get that toe nice and lateral. Okay? So, Daniel, can you scoot your hips back a little bit? Yeah, then turn your hips all the way. There you go. Good. I'm going to turn your foot all the way. See, we might better do it without it. Okay. All right. There you go. Perfect. Right? So yes, this is horrible for the patient. So try not to keep them here for too long. Sorry, Daniel. Okay. This is why a lot of techs just prefer to do lateral rotation laterals, even if you have OID. Okay, but for at least the big toe, this is the ideal way to do it. Right, get these toes out of the way, big toe is out, center at the IP with a medial rotation lateral. Okay, very good, Daniel. Is everyone done with your pictures?